Okay, welcome back, class. We are continuing with the Unit 11, Vital Signs, which is Chapter 13 in your book. Vital signs include temperature, pulse, respiration, and sometimes that is abbreviated as TPR, blood pressure, obviously abbreviated as BP, and then pain, which is subjective. The reason for taking vital signs to check for signs of illness, potential health problems, and the response to treatment. Never guess on vital signs. If you don't know it, or if you don't think you hear it, then ask somebody else to check it with you. There are times, unfortunately this happens, there are times when I've gone to check my vitals list and there will be vital signs written down on somebody who had been discharged and was at the hospital. So be very careful and make sure sometimes those vital signs just kind of get radioed in from somewhere, and you make sure you're being honest with that. Report any abnormal vital signs to the nurse immediately. This slide shows just your temperatures and your pulse and your respiration. This is your TPR slide. So we have mouth, which is oral, rectal, axillary is your armpit, tympanic is your ear, and then temporal artery is your forehead. And then there's different levels for each of those. And then your pulse is 60 to 100 beats per minute. And respiratory rate, you should have 12 to 20 breaths per minute. And so for your test, there'll be questions like, which vital sign would you report immediately, and that kind of thing. So make sure you have a baseline that you know. This is quite a graph for blood pressure. The ideal blood pressure, they say, is 120 over 80, which is systolic being 120 and diastolic being 80. This is the different stages of hypertension. Oops, that low should say hypotension, I'm sorry. So we got normal, low, or hypotension, then elevated, and then it's not considered hypertension until we're up over 130. So this is a range where it would just be elevated, and then these are like consistent. If it's a one time, they probably wouldn't report that, but generally 140 over 90. Sometimes you'll go and say, yeah, their blood pressure's up, and you'll tell them it's 130 over 80, and they'll be like, yeah, so, because they don't get concerned about that. But it's still something that you should report because it is considered elevated. Anything over 180 on the top or 120, those are the people that are at risk of having a stroke when they're that high like that. So that would be something you definitely would report immediately. Low temperature, hypothermia, which would mean blood temperature is below normal level required for normal functioning. A fever is an increase in body temperature above normal. That may indicate illness or infection. The symptoms are usually fatigue, headache, chills, muscle aches. You guys know what it feels like to have a fever, right? Main sites for taking a temperature. That was kind of in the table. But just to remember that oral, by mouth, is the most common. Rectal is the most accurate. And your armpit or axillary is the least accurate. There are different types of thermometers. There's a glass mercury thermometer. There's a digital, electronic, disposable, tympanic, and temporal. And now I see they have like the laser one that you just shoot at their head too. I guess that's reading your temporal artery though. It can be written in two different scales, Fahrenheit or Celsius. The United States still use Fahrenheit for everything, but a lot of your thermometers will have both Fahrenheit and Celsius. Does red or blue color coding on a thermometer matter? The answer is yes. Red means rectal and blue means oral, so you need to pay attention to the probe color. Do not use a oral site, or don't take a temperature in the mouth, basically on somebody who is unconscious, if they are on oxygen. If they are confused, which that, if they don't understand why you're putting it in their mouth and that kind of thing. Seizure, injury to face, an NG tube, or anyone younger than 6 years old. I know pediatric patients all the time, the doctor will most of the time write rectal temperatures only on pediatric patients. Wait 10 to 20 minutes before taking a temperature if the resident has been eating or drinking fluids, has just smoked, has been chewing gum, or exercising. Pulse, the definition would be the wave of blood through the artery as the heart contracts. Terms to learn: tachycardia and bradycardia. Tachycardia would be a pulse rate above normal, so above 100. And bradycardia would be a pulse rate below normal, which would be below 60. The sites used to measure pulse is on page 238 and 240 in your book. You need to know that for your quiz. Carotid pulse is in your neck. Temporal is by your temples. Apical is your heart. That comes from the apex of your heart. So when somebody listens to your heart rate with a stethoscope, that is an apical pulse. Brachial is in the bend of your arm. Radial is along your thumb. Femoral is in your groin area. Popliteal is behind the knee. And a pedal pulse, or dorsalis pedis, is on the top of your foot. Radial pulse is the most common site. You're going to be the inside of the wrist on the thumb side. You never use your thumb to take a pulse. You always use your fingertips, not your thumb, because your thumb has its own pulse. When checking a pulse, you're going to observe for the pulse rate, which is the number of beats in the minute. Regular, the pattern, which is it regular or irregular, and the quality, is it weak or strong? Sometimes you feel it and it's like it feels really thready, and sometimes it feels really bounding. So that was it on pulse. Now we're on to respirations. A respiration is, we talked about that in the respiratory chapter. One breath in and one breath out equals one respiration. Respirations are counted after the pulse. So if you're counting the pulse for 30 seconds and then multiplying times 2, you're going to keep your hand just like this and switch and start counting respirations. That is because they're more likely to breathe normal if they think you're still taking their pulse. They can breathe different when they think you're watching them breathe. Respiratory rate is the number of respirations in 1 minute. The pattern of respirations, you're going to say again, were they regular or irregular? Quality of breathing, do you hear noises? Are they wheezing? That kind of thing. Having difficulty breathing, or they have to sit up to breathe, which was orthopnea, if you remember that. Terms that go with breathing. Apnea means they're not breathing at all. Dyspnea means they're having difficulty breathing. And eupnea is normal breathing. Orthopnea, shortness of breath when lying down. It's relieved by sitting upright. Tachypnea is rapid breathing, just like tachycardia is rapid heartbeat. So tachy means fast. Cheyne-Stokes are irregular patterns of breathing and periods of apnea, followed by a rapid, shallow breathing. Apical pulse, that's what I was saying. It's heard with the stethoscope on the left side of the chest, just below the nipple line. Used when it's difficult to feel a pulse, or they're weak or irregular. On infants and children less than 2 years old, they usually will do an apical pulse as well. So apical radial pulse is when you're checking both because you want them to match. So taken to compare apical pulse to a pulse elsewhere in the body, they should be the same. It shouldn't be different. Blood pressure is the measurement of the force of walls against the walls of the arteries. I'm going to stop there because that's almost 10 minutes.